Good afternoon. Together, this group will be rebutting the notion that health expenditure in Australia is sufficient to ensure a healthy population. Isabel will explore the lack of funding for research on chronic illnesses, which leaves a large group of people with a poor health status. I will navigate us through Aboriginal and Torres Strait Islander healthcare and how the lack of funding has created a massive difference in the health status of First Nations and non-First Nations peoples. Paige is going to discuss the notion that the lack of investment in education for allied health is compromising the workforce, which furthermore impacts people's abilities to receive quality healthcare. Lastly, Shannon is going to investigate how the lack of funding for early intervention is affecting the level of health for Australia's population.
In Australia, chronic illnesses is a long-lasting condition that has a persistent effect on an individual's social and economic status. This has a large impact on an individual's trajectory and quality of life. Chronic conditions are becoming increasingly common and need to become a priority in the healthcare sector. For example, from 2020 to 2021, it was estimated that 15.4 million, 61%, are living with at least one selected chronic long-term condition. Over 6.4 million individuals were hospitalised due to a chronic condition. This includes a variety of ages, such as 28% of 0 to 14 aged and 94 aged over 85. Based on the following statistics, it is clearly evident that minimum funding has been invested into the research of chronic illnesses. Therefore, I fail to agree with the notion that health expenditure in Australia is significant to ensure a healthy population. During 2020 to 2021, the Australian government invested $5.5 billion into health and medical research. In real terms, spending on research has increased by 1.2% between 2020 to 2021. However, this is lower than the decade average of 3.20, therefore resulting in a minimum amount being invested. This creates a burden on individuals with chronic diseases as treatments and further research has been minimised of an illness that is continuing to become ongoing.
Agreeing with the notion that health expenditure in Australia is sufficient to ensure a healthy population simply ignores the struggles of our First Nations people. From 2017 to 2019, under 3 in 10 people, 29%, of First Nations adults aged between 18 and 64 were in good health, compared to the 51% of non-First Nations peoples. This figure strongly suggests that the government is not funding enough money to ensure this population is appropriately supported in the healthcare system. First Nations people makes up 15% of the population in remote areas and 49% of the population in very remote areas. Rural and remote areas experience health inequality because of the decreased access to health services and lower standard of health infrastructure. As Aboriginal people make up majority of these populations, they are experiencing the hardships of these inequalities.
Hi, my name is Paige and I will be discussing the lack of investment in education for allied health. It is evident there is a lack of investment in allied health education and training. This insufficient investment is causing a shortage of workers in the field. Research has shown there is a widening gap between the demand of these services and the available healthcare professionals. Longer waits can worsen health outcomes for patients and place additional pressure on other parts of the healthcare system. Investing in allied health education will address workforce shortages, but also offer broader economic benefits. Research has suggested that increased funding could also reduce healthcare costs. Insufficient investment leads to higher long-term costs due to the increased demand for acute care services. Limited resources can result in outdated training materials and fewer clinical placements. Investing in allied health education is crucial for addressing workforce shortages, reducing patient wait times, and ensuring high-quality care.
Australia's health expenditure remains insufficient to ensure a healthy population due to inadequate funding for early intervention and preventative health measures. The Australian government allocated $250.9 million over 4 years to initiatives aimed at reducing the impact of chronic conditions and improving public health. However, this funding is minimal compared to the broader health expenditure. indicating a disproportionate allocation that limits the effectiveness of early intervention strategies. For instance, specific mental health early intervention programs received only $16.9 million, which, while beneficial, is inadequate given the escalating mental health challenges across the nation. This underfunding results in a healthcare system that is more reactive than proactive. Early intervention could significantly reduce long-term health costs and improve overall health outcomes. The healthcare system remains burdened with managing these preventable conditions. The insufficient funding for early intervention programs undermines the potential for a healthier population.
In conclusion, it is clearly evident that the notion health expenditure in Australia is significant to ensure healthy population is invalid. It was observed and highlighted that the Australian government has spent minimum funding towards research for chronic illnesses, lack of support for early intervention, lowest level of funding for Aboriginals and Torres Strait Islanders, and significant investment in education for allied health. As a team, our argument demonstrates an accurate understanding and creates awareness of health equity in Australia.